Welcome to the Radiology Review podcast, your on-the-go source for radiology education with your host, Dr. Matt Covington, a board-certified radiologist. Please follow the podcast on Twitter at RadRevPodcast. Send emails to theradiologyreview@gmail.com or visit the website theradiologyreview.com.
Welcome back to the podcast. Today I want to talk about the 5 measures of purity in nuclear medicine. And if you're not aware that there are 5 measures of purity, well, there are, okay? The first is chemical purity, the second, radiochemical purity, third, radionuclide purity, fourth, physical purity, fifth, biological purity. These can be hard to remember, but they also are easy to write questions on. And I do expect that you will be asked some questions about this, so let's spend some time learning this. Chemical purity refers to, do you have the type of chemical you want in the preparation, or is there something else in there? The most common scenario that we'll ask about chemical purity is the amount of aluminum breakthrough in a Molytech generator. You need to know that the amount of aluminum that is allowable from a Molytech generator is less than 10 micrograms per milliliter. Remember 2 things here. First is 10, and the second is microgram per milliliter. That is different from the 0.15 microcurie per milliliter that we'll get into for radionuclide purity, okay? Chemical purity, the chemical we're talking about is aluminum ion. The allowable amount is under 10 microgram per milliliter. Okay, this isn't a millicurie, it's a microgram because the aluminum is not radioactive. So radionuclide purity, you're already thinking nuclide, radioactive. We're going to have a unit that's some sort of curie, in this case microcurie, 0.15 microcurie per millicurie of tech. For chemical purity, you're going to have microgram per milliliter because we're talking about aluminum. And to test that, you do a calorimetric measurement, which is kind of a color-based test where you drop the liquid from the generator on special paper and you see if it changes colors. Along these lines, let's talk about what happens if you have too much aluminum in your tech preparation. Interestingly, what happens depends on the pharmaceutical that is attached to technetium. So in the case of technetium sulfur colloid, if you have too much aluminum, you will see uptake that is abnormal in the lung. However, if you have technetium MDP with too much aluminum, you will see abnormal uptake in the liver. Okay, so too much aluminum with sulfur colloid, that ends up in the lung. Too much aluminum with MDP, that ends up in the liver. That's all fair game for the examination. To make sure you don't have too much aluminum, you test the chemical purity using paper chromatography. Got it? All right, let's move on to radiochemical purity. Chemical purity does not have radiation involved, that's aluminum. Radiochemical purity now means the fraction of total radioactivity that is in the desired chemical form. The most commonly tested question on this is going to be the amount of free technetium you have in a technetium radiopharmaceutical that is not supposed to be free technetium, such as MDP for a bone scan, or any other radiopharmaceutical that you're preparing. You don't want the free tech. That causes artifact and uptake in other places you may not want. So if you have a pure radiochemical, it will be in the form that is desired. Remember, for example, poor radiochemical purity means you have a lot of free technetium. It means it didn't bind to the pharmaceutical and you have an issue. Remember that to evaluate for free technetium, you look for a few things. One is uptake in the salivary glands in the head and neck region. The other is really hot uptake in the stomach. Those are 2 telltale signs that you may have free technetium present. Remember that with radiochemical purity, they will most often ask you about free technetium as the impurity. Radionuclide purity, we already mentioned briefly, but really the one thing they're going to ask a lot about this is the ratio of tech versus molybdenum that you get from the generator. Radionuclide purity is the fraction of total radioactivity that is in the desired form. From the generator, we want technetium, we do not want molybdenum. The allowable amount you absolutely have to know, and this is something you might want to write down on a sheet to study the week or day before the exam, as is the chemical purity. Less than 0.15 microcurie per millicurie. Okay, remember, we have a unit of radiation in microcurie. This is 0.15. I've always found these two numbers hard to remember, and I mix them up a lot. So molybdenum breakthrough 0.15 microcurie per millicurie. Okay, it's not millicurie. A common trick on this on multiple choice questions is to give you the 0.15, but the unit will be wrong. Maybe they'll say millicurie or something else. So you need to remember 0.15 microcurie per millicurie of molybdenum. On the other hand, I'll repeat it again. Aluminum is less than 10 micrograms per milliliter. All right, I think I've covered that enough. Write that down. Make sure you have that in your brain clear before you take the exam. You only really have to remember it one day of your life, or 2 days actually, and those are the 2 days you take the core. Any other time you can look it up. Let's get into physical purity. That is the total amount of pharmaceutical in the desired form. One example is that you have the correct particle size that you want. If you have something where particles are important, such as lymphoscintigraphy or maybe Tech99m MAA. Okay, so again, physical purity, the fraction of total pharmaceutical in desired physical form. I think it's less likely you will get a question on this. They tend to focus on the other ones because there's no number that you painfully have to memorize for this one, but still know what it is. And the last is biological purity, which is the absence of microorganisms or other sort of biologically active things like pyrogens that can cause harm to patients. So biological purity, you're keeping the bad bugs out, okay? Physical purity, you have the desired physical form you're looking for. Radionuclide purity, you got Tech rather than molybdenum. Radiochemical purity, you do not have a lot of free Tech when you actually want Tech labeled to a pharmaceutical. And chemical purity, you're keeping the aluminum out. I think that covers enough for now. If this is helpful, please share with a friend. Please get more of your co-residents to listen to this. And please tune in for my next episode. Content of this podcast is provided for informal educational purposes only for radiology trainees and radiologists. Medical practitioners, please make your own independent assessment before suggesting a diagnosis or recommending any course of treatment. This podcast should not be used for self-diagnosis or self-treatment and is not a substitute for independent professional medical care. Please consult your own physician regarding any diagnosis, imaging interpretation, or course of treatment.